This kind of segues into the often made question of what if they've had a recent stress test? Well, that actually makes the chest pain pathway a little bit harder to utilize because that's a big component of it. That's part of the reason it's there is so that we can stress them. And if they had a recent stress test that was negative, and you know that, we all know that that doesn't guarantee that they're not having a heart attack now. But if they had a recent stress test, it's going to be hard to know what you're going to do with that second stress test. And so I have a much lower threshold of kicking these to cards.
Absolutely. So, right now, because of various reasons, we have exercise test, exercise EKG stress test on the weekends, and stress echoes during the week. So that is two different forms of tests with two different sensitivities. The exercise EKG, or the exercise stress test, as Dan was saying, is really only good for 30-day mortality. It doesn't tell you anything about coronary artery disease. So if somebody comes back in the next day after having one of those, doesn't mean anything. Just trash it. It's like it never happened unless it was positive. A exercise or a stress echo is pretty good. But even if that was negative and they come back in with chest pain, what are you going to do with it? Are they in the, I erased the thing up there, but are they ones that the test missed? And if they missed it one time, are they going to miss it again? All right. So what do they need at that point? Do they need a different test? Do they need a different stress test? Or do they need to have a cath and get it figured out? So most people would go with a cath at that point. So those are ones I admit to the hospital.